this is on to what I would say is my favorite part of the day. The discussions are great, the networking is great, but always enjoy an opportunity to recognize folks who are doing just some great work in our community. So we're going to move on to the awards portion of our program, and then we'll follow that up with lunch thereafter. So I do want to invite up our incoming board chair for the Hospital Association of San Diego Imperial Counties, Jane Finley.
It's my great honor to be presenting the Community Leadership Awards to a number of key organizations in the communities we serve that certainly understand the core issue around a key social determinant of health, which is hunger. Hunger is a real issue in our region. In Imperial Valley, more than 1 in 6 residents are food insecure. 1 in 3 children are food insecure, according to the Imperial Valley Food Bank estimates. 1 in 3. For San Diego County, the San Diego Hunger Coalition estimates nearly 510,000 people, 160,000 of those are children that are food insecure in this community. Just to put it in perspective, 160,000 people is roughly the size of Oceanside, and those are our hungry children every day. Thanks to the great work of Feeding San Diego, the Jacobs and Cushman San Diego Food Bank, and the Imperial Valley Food Bank, over 214,000 people a month are given fresh produce and non-perishable goods. That's over 13 million pounds of food to families in need. In collaboration with the food banks, the San Diego Hunger Coalition spearheads the Hunger Free San Diego. It's a partnership of these agencies that fight hunger every day in our communities. Now, CalFresh is a critical program to address hunger. I think Jim Floros said it best when he claimed CalFresh is the single strongest line of defense against food insecurity. Now, the food banks and Hunger Coalition help residents receive access to CalFresh and actually provide structures for them to actually receive food. These agencies are collaborating in new and innovative ways with hospitals, clinics, physicians, and community agencies to identify patients who are food insecure and connect them to food programs and CalFresh. We look forward to growing these partnerships and addressing a key social determinant. We've talked a lot about that today, which is just flat out food insecurity. So I'm very proud to present the first Community Leadership Award to Feeding San Diego, Vince Hall, CEO.
I just want to thank you very, very much for paying attention to the issue of food security, and I want to compliment my colleagues for the incredible work that they do in the community every day, and we're really proud as Feeding San Diego to be a part of solving hunger in San Diego County. We have a long way to go, but we're making great inroads. So thank you for your support.
Thank you. The second goes to the Imperial Valley Food Bank, to be accepted by Sarah Griffin, CEO.
I'll just say thank you for the invite to San Diego County. It's lovely to be here with you. I want to thank my CEOs in Imperial County for this recognition and for working with us in amazing ways. We have a long road to go in Imperial, but with the collaboration that we have already started, we're going to get there. Thank you.
Thank you. The next Community Leadership Award goes to the Jacobs and Cushman San Diego Food Bank, accepted by Jim Floros.
I didn't prepare a half-hour speech, so I'm sure you're disappointed in that. I just want to really, compliment our colleagues and all the hard work and great partners. Many of them are in this room. What people are really stunned to learn about who really is hungry, the face of hunger in San Diego County. It's working poor, seniors on a fixed income, children living in poverty, and believe it or not, active duty military, their dependents and veterans. So we got a lot of work to do, but with your support and our bridge to the medical community, hopefully we can get there. So thank you very much.
And last but not least, the San Diego Hunger Coalition, award to be accepted by Anahid Raki.
We're incredibly thrilled. My colleague, Amanda Schultz, is a real leader in this area. I've brought our white paper if you'd like to take a look. There's some extra copies out front, outlines 6 of the pilots that we've done with our fantastic partners here on the ground and some of the best practices that we've identified. Thank you again.
Thank you.
So while the leadership awards are a great recognition, and it really does highlight the work that our local food banks and agencies are doing, I also want to have a few recognitions which are a little more bittersweet. The first is Jody Root. Jody, where are you? Come on up, Jody. For those who aren't aware, Jody has announced his retirement. I don't know if it was a race to the door between he and Dwayne, but there's maybe something to that. Maybe Jody can comment. But frankly, if you've been a part of San Diego Healthcare, you've heard or you have worked with Jody at some point in time. Jody has been the pulse point of many decisions, mergers, acquisitions, and successes for his over 32 years of service. Put that in context. Dwayne has been here 32 years. Jody's been here 32 years. So it's been quite an incredible partnership that we've had locally with Jody, and really do appreciate it and wish Jody nothing but the best as he finds what's next. He's already, and I'm sure he'd be happy to share, doing a lot of great work training service dogs with our military up at Camp Pendleton, and I'm sure Jody will find any number of activities to keep him busy in retirement. So Jody?
Thank you. It's been an honor to work with this group and all the individual hospitals and other providers in town. And it's particularly nice that I got to do it with Dwayne for all 32 years. One of the most remarkable people I've met in the healthcare industry. So thank you all. I got Freedom Dogs is my nonprofit that trains service dogs at Camp Pendleton. I have PTSD. Got 5 grandkids, a couple nonprofits, so I think I'll be busy. So thank you.
Thank you, Jody. The next person that we want to call up is Michael Barden. Michael, where are you? So we're getting an early start on Michael because technically Michael doesn't retire till after the new year. But if you've been around Michael lately, he has a smile like the one he's wearing on his face now, which makes you know that he's really looking forward to some time away. Michael has been a passionate voice for hospitals and meeting the health needs of our community in his career that has spanned over 3 decades at Scripps Health. You know, we talked about Jody and we talked about Dwayne, 32 years. Michael has an interesting designation that I like to say, which is 1BD. And that is 1 year before Dwayne Donner. Michael is probably the only person here who has outlasted Dwayne as well. So it's fitting that they go out at similar times. But for the record, Michael is trying to outlast Dwayne again by hanging on till January as well. So Michael has been a key confidant, a key stakeholder. I mean, he is a voice for Scripps as well as our region, quite passionate, and obviously it's bittersweet. I know we'll see Michael around. He obviously has some other interests that he's going to be doing with Rotary and other groups, so it's not like he's falling off. And as I like to remind Michael, he's got to be involved because if he retires and we screw it up, he's still stuck with whatever it is. So, Michael, come on up. Feel free to.
Well, number one, this wasn't expected. One doesn't mark their life, I guess, by what recognition, awards they get or whatever, but it certainly is appreciated. I know most of the people in the room. That's very rewarding and satisfying. I am going to miss many of them. Hopefully I will see many still. And as Demetrius mentioned, my plans going forward are to be involved much more aggressively in Rotary's peace-building programs. And so my sort of metaphor for that is all this health policy stuff, I am transferring into the world of world peace. And I think world peace might be easier. Thank you.
Thank you. Well, and Michael, to that point, some have said healthcare is just so complicated. So with that, one more recognition that we'd like to offer up before lunch, and that is Bob Hemker. Bob, where are you? So I really think there is something to it because for those who aren't aware, Bob recently retired. So it seems to be a run for the door, and we're seeing who's going to be the last one to catch the lights. But, you know, I really want to thank Bob. I've had the pleasure of working with Bob in the past year as our board chair here down here in San Diego. And we've been fortunate to have Bob as a tireless advocate on our behalf, going to Sacramento, going to DC, and just quite passionate about the work that he does, as well as the work that he's done with Palomar Health. He's been on the HASDIC board since 2014, and then prior, he was on the board in 2002 as well. So, Bob, on behalf of the Hospital Association, we definitely want to wish you the best in your retirement, and we look forward to hearing how long your wife lets you stay home before she kicks you back out of the house.
Thanks, Demetrius. You know, I look out
I know many of you out here, if not most of you, and the healthcare community of San Diego and Imperial counties, it's a very special family. And it's one that I've had the privilege of being with for a number of years, 16 plus years, that I've been able to serve each and every one of you in what you do for our communities. We heard so much of it today. The needs are endless. It's getting more and more complex out there in terms of what's happening in healthcare, both federally, locally, et cetera. But it's a very special group. Look around. You should thank each of yourselves and respect each of you. Yes, and some days we might say we compete with each other, but we really don't. We all have the same common thing we're trying to achieve, and that's serving our communities and their healthcare needs in a never-changing climate. And it has been my privilege to be part of a small part of helping to do a little bit more for our communities. It's been a privilege to serve with HASDIC, with other associations. Go back a number of years with Dwayne as well, serving on CHA. So I look forward to, I'm not sure what the next chapter, as you say, Marianne, we'll see if she lets me stay in the house for a week, a month, a year. We've joked a long time about this, that I'll get banned to the garage at 8 in the morning and can come back in at 6 p.m. We'll see. Jody, I lost track of where you're at, Jody. I also have 5 grandkids that I get a chance to reconnect with. They're going to be growing up way too fast, and we all commit ourselves well over 100% to our professional careers, and now it's time to try and do that with the personal family challenges as well. So thank you.